All right, if we can all just grab our seats. I'm really excited about this next part of our morning session where we can bring things to a somewhat more concrete level. So the structure, we have 45 minutes before lunch. And actually, before we launch into this, just a quick announcement. For the members of our committee who are involved in the organization of the data integration workshop coming up in a few months, we ask when you head to lunch, if you could go upstairs and get your lunch and then come back down and meet Ben Wendler. Let's see, is he back there somewhere? Anyway, he'll be right back. But anyway, he's going to be in room 102. So I think it's one of these rooms kind of around behind us. And so if you could meet with him at lunch. So again, those are the members of the organizing committee for the data integration workshop. That would be really helpful. So for our next 45 minutes, we're structuring the time so that Lynn Goldman, who we just heard from a couple minutes ago, will be spending about 15 minutes. And then Stan Barone will present a perspective for 15 minutes, and then we'll have 15 minutes for them to kind of get a discussion started, and then we would love to have all of you interact with them during that last 15 minutes. So I'll invite Lynn Goldman from the George Washington University to come up and get us started on this conversation on replacing the uterotrophic assay. Thanks, Lynn.
Okay, so 15 minutes, and I see the little timer is here, although they haven't started it. Am I supposed to start it? Anyway, I need it. So as I promised to do, I'm going to talk to you a little bit about endocrine disruptor screening as kind of a case study about emerging science in public health. And let's see, next slide. I'm guessing it's that. Maybe not. It's at the green arrow that appears to be pointing forward. There we go. So, we all know that there's a reason, to try to do a better job with quickly assessing risks of chemicals, because we've had many lessons, in our lives. Most of us here in the room have had experience with some of these chemicals, these POPs chemicals and metals that turned out to be much more toxic to humans than people thought they would be and have persisted in our environment. And I always often start talks nowadays with this slide. Josh Letterberg, who served on the President's Commission for Risk Assessment and Risk Management, who, was one of the first people in my career to warn me about the fact that regulatory science very too often gets pushed into a box, and we forget to be scientists and we forget to use the science. So I just show his slide to remind us of this. I think you all know what the endocrine system is, that this is a very important part of our body and other animals. All organisms, birds, fish, and multicellular organisms have some kind of endocrine system. And that, of course, that these systems depend on the release of hormones that are like chemical messengers. There are more than 50 of them, where I'm only going to talk about a few, and they regulate all biological processes in the body. And this is the thing that I think is so important, the very profound impact of hormones on the development of the brain and central nervous system, on growth and of the body, growth and function of the reproductive system, metabolism, blood sugar levels, and in many cases, cancers as well. So this is, kind of a schematic just to remind us all that, yes, it's estrogen, it's androgens, but it's also thyroid hormones, the parathyroids. The central nervous system is involved, and we now realize also that hormones are released by the digestive system as a part of appetite and metabolism. So endocrine active compounds, what are they? Endocrine active compounds are compounds that have a number of possible modes of action that might somehow impact the hormonal system. They might directly mimic a natural hormone, that is, go to where that hormone would go and have the same effect that hormone might have. But they might also block a natural hormone, go to that site, that same site, and rather than having a positive impact, an agonist impact, block so that the natural hormone is not able to insert into that site, but they can also affect the production, either increasing or decreasing the production of natural hormones. And so this issue of endocrine active compounds is a very, very complicated one. But we also use the term endocrine disruptors. Endocrine disruptors are when we have an endocrine active compound where we're not intending to have the endocrine effect. So if somebody is taking a hormone, say as part of cancer treatment, for say prostate cancer or breast cancer, that is an intended hormonal effect. Endocrine disruptors have unintentional effects that may be harmful. So EPA, back in 1996, I was there at the time, so I guess that's why I was asked to give this talk, had some statutory authority handed it to develop a program for monitoring chemicals for endocrine disrupting potential. And in particular, in the Federal Food, Drug, and Cosmetic Act, which, by the way, in answer to an earlier question from Dr. Craner, cosmetics are regulated by the Food and Drug Administration, not the EPA. So it wasn't all my fault. But anyway, under the FFDCA, we were required to develop a screening program using appropriate validated test systems and other scientifically relevant information. So that's broad, to determine if certain substances may have effects in humans similar to an effect produced by a naturally occurring estrogen. But the law went on to say that the administrator could also include other endocrine effects, such as androgen and thyroid, okay? And that not only pesticides were covered, but also non-pesticidal ingredients that may have effects cumulative to a pesticide or to which a substantial human population may be exposed. The Safe Drinking Water Act that very same summer was also enacted, and it included language that said chemical substances found in the drinking water could be tested under this kind of regime. And in fact, both of these came from a single senator from New York, Alphonse D'Amato. They were called the D'Amato Amendments, and he did that because of his association with the Breast Cancer Coalition. And so, you know, this kind of goes back to the notion that back then that these chemicals might be involved with cancer. And so in order to meet the mandates, we set up a program that was informed by a federal advisory committee that was called the EDSTAC, the Endocrine Disrupters Screening and Testing Advisory Committee, met intensively for 2 years and developed an actual consensus involving many people that from industry, from academia, from environmental groups. Stan Barone was around EPA at that time, put a lot of effort into that. A lot of agency effort went into this. And there were some key recommendations. I mean, one, that this was not just about human health, it was also about wildlife. Second, that we should include estrogen, thyroid, and androgen pathways, or like EAT. And third, and I think this was very important in terms of some of the debates today, that there would be a two-tiered screening and testing program. The idea of tiering when you had so many chemicals that had not been assessed in this way. And so the conceptual framework, the two-tier idea, is that tier 1 screening would just monitor for the potential to interact with estrogen, androgen, or thyroid hormone systems. And tier 2, you know, with the things coming out of tier 1 that seem to be positive, then there would be more testing that would, in order to not only characterize these better, but also to be able to look at dose-response relationships. And from an earlier talk today, I think you understand, you know, how dose-response comes to play, as Gary said, when you're actually doing a standard. It kind of helps to know where you are. So, but this was a very long road. So even with an incredible consensus, reports to Congress, Congressional oversight that has happened over the years, this is a 21-year path that we're telling you about. And with periods of time, frankly, where very little happened, and then other periods of time where a lot of things happened. Those happen to be in different presidential administrations, but I'll let you come to your own conclusions about that. But the conceptual framework has remained the same over this, and that is there's kind of a pre-screen which things ought to be screened. So not everything is going to be screened. A tier 1, screening and weight of evidence, a tier 2, test methods. However, over the years, the actual instruments, the test instruments that have been used have changed. And one of the things that I felt very sad about a long time ago, in fact, the last time I talked about this in any meeting of the National Academies, which was in 2009, I was kind of, well, by the time EPA had validated the tests, all the scientific community said all the tests are out of date, which is what I kept hearing. And it's a moving target, and the processes for achieving enough consensus to move forward not only involve everybody coming around for 2 years and deciding what the framework should look like, but each test, precisely how do you do it, which species, how many of each species, what tissues do you look at, or which cellular receptors are you using? And of course, the science is changing all of the time, so it never can be completely up to date. But this is the battery, and for tier 1, as it looks today, still includes estrogen receptor binding, but also transcription, which was not available at that time, androgen receptor binding, steroidogenesis, the process of actually making steroids, aromatase, which has to do with the conversion to androgens, and in vivo assays, a uterotrophic assay, which was there at the beginning, the Hirschberger female-male in vivo assays, pubertal female rat, pubertal male rat, and then something called the amphibian metamorphosis assay in the frog, and a fish short-term reproduction assay. And my partner in crime here knows much more about these assays than I do. But the tier 1 assays, this is kind of a chart that the agency prepared, thanks to the EPA for doing that, because I never could have done this in a million years. And that is, whether it's either estrogen agonist or antagonist, androgen agonist, antagonist, affects thyroid, and other effects. So then they also have very much revised the tier 2, not completely, the mammalian 2-generation reproduction. It still seems to be considered to be a kind of a gold standard. The extended 1-generation reproduction in the rat. Ecological tests, these have changed quite a bit in terms of the kinds of further studies that are done in the second tier to be able to determine if indeed these effects are occurring at doses that are relevant, in terms of uses. So, the tier 1 and tier 2, there's a real virtue to it in terms of in tier 1, having a relatively short-term and low-cost way of very quickly looking at a lot of chemicals, minimizing the false negatives. So back to our earlier discussion, to heck with R.A. Fisher, if we're talking about screening, what we're really concerned about is having false negatives, tossing things out of the funnel before you've had a chance to really look at them. And so the idea, the whole concept was that a lot of things moving down the funnel would at the end of the day turn out to be negative, but we didn't want to have false negatives coming out at the top and thereby, as Carl would say, forever, being on the market. That was kind of the notion. And also, limited doses, both in vitro and in vivo, and the battery is all 11 assays. The tier 2, they're longer term, they're more definitive, but they're more expensive, they use more animals, but they do allow you to get a dose response, and you can do them in a more targeted fashion. So one of the things that happened that I'm delighted by, actually, although it took a long time to do it, I will whine about that a little bit, but eventually, EPA was able to actually come up with an initial list of 67 pesticide chemicals to put through Tier 1 and actually did impose upon the industry a rule that they had to, in order to do these. And one of the things that nobody talks about, and I think it's very important to understand this, that actually of the 67, 15 of them, rather than being screened, were removed from the market. Now, you know, we scientists often don't get close enough to what's going on in industry to understand how decisions are made within companies. But I've gotten to know quite a bit about that from also being a regulator. And despite the fact that there's this viewpoint that, you know, the environmentalists are over here and industry is over there, very often when industry sees things that don't look pretty in terms of the risks of their products, they stop making them. And, you know, we kind of don't give them enough credit for that. And I mean, that is one way that the world has changed tremendously, you know, really since 1971. And, you know, that as soon as the government started looking at risks and assessing risks, we had this happening. All right, so 52 chemicals had data submitted, actually, and there were some recommendations that were made. Interestingly, 14 of those, there were some potential interactions, but no recommendations for additional testing because they felt they already had data from the testing that had already been done. Pesticides tend to be very extensively tested as a part of registration. It's different than the world of other chemicals regulated under TSCA. And there were 18 of them that were recommended for additional testing. I think it's very interesting what the EPA ended up doing with that. For human health, the ones recommended for additional testing, 3 of them were not for the Tier 2 battery, but rather a new battery called the Comparative Thyroid Assay. So, and I think that that's a good thing, actually, a la Dr. Letterberg. Let's think like scientists, not like, this is not a little cookie cutter exercise. If that's what needed to be done, well, you know, hooray for EPA for that. Wildlife, almost all of these triggered concerns about risk to wildlife and either needed to have a mammalian study or a study in non-mammalian species. So, you know, what have we learned? 21 years. I have my little list here, you know, 3 advisory committees, 7 policy statements, Tier 1 and Tier 2 tests, 67 referred for screening, 15 off the market, 18 went into Tier 2. So, you know, that's not a lot of progress in 21 years compared to what we hoped for, I would say, in 1996. But it isn't a lack of progress either, you know, and I think that it's important to understand this is the first time that such a screening and testing regime had ever been set up. I mean, I would say a lot of the people who are the most avid supporters of this process moved on to other things, you know, did not continue to follow up, have not continued to support the agency's efforts. And I worry about the follow-up on the Tier 2 testing and the will of the agency to move forward with other pesticides. I totally do. But beyond the pesticides, there is the 2016 Lautenberg Chemical Safety Act, which is far more daunting, 80,000 chemicals that are on the market approximately, and as someone said earlier, about 700 new ones each year, and a new health-based standard that EPA has to apply, including, according to the law, the administrator shall, that means has to, okay, apply a tiered screening and testing process. And so this notion of tiering, which came about because of an advisory committee and was not in the law for the endocrine disruptor process, is in the law now for toxic chemicals. And high priority has been defined. The word endocrine does not appear in a sentence, but it does say unreasonable risk of injury to health or the environment because of potential hazard and route of exposure, and that specific vulnerable subpopulations are identified in the Act, including infants, children, pregnant women, workers, or the elderly. And so I think as soon as you start talking about infants, children, and pregnant women, that is invoking endocrine-mediated effects. The law also requires the EPA to reduce the use of animals, and after not later than 2 years after the date of enactment, I'm sure this committee is very focused on this, develop a strategic plan to promote the development and implementation of alternative test methods. That means, by the way, July of 2018. That's when that is due. And then every 5 years, a report to Congress describing their process, which, as you can see with the Endocrine Committee, the report to Congress, some years may have more progress than other years, but nonetheless, there is congressional oversight for this. So it's this very National Academy of Sciences that wrote the toxicity testing in the 21st century report back in the 20th century, and it is the 21st century now. So we are seeing that some of this is becoming a reality, and that we do have the promise of being able to take advantage of the science of biology, epigenetics, and computox, as well as the fact that decisions may be made not just by regulators and the government, but also by the people who manufacture the chemicals. Some of the lessons that I think might be important, and support from stakeholders, administration, and Congress for the long-term investment. This is the long haul. This isn't a short-term deal. And strong partnerships within the government across not only EPA, but NIEHS, FDA, the CDC, ATSCR, the states, the universities, and industry. Those partnerships need to be there. Sensitivity of the regulatory environment. If these new modalities are not used to make decisions, if they aren't verified, they'll fall by the wayside. And last but not least, that it's extremely difficult to move new science into regulatory science. That so much of regulatory science, I'm just going to say it, it's still 1980s science. It still is, so much of it. And that we consider something to be, kind of the gold standard, when it's science that's from decades back, and that where we know so much more today. So there are a lot of potential benefits to tiering, letting EPA use more relevant data, but there are major risks, and one is that a major overhaul could be used as a context for not doing toxicity testing, for not gathering information. That's a major risk. And that, stakeholders, including scientists, including the people in the room, need to be a constituency for continuing to forward efforts, including that the agency is evaluating chemicals with tools that you personally may feel are not perfect, to not let the perfect be the enemy of the good. It is a bad thing when things are brought to a halt and nothing is done. So, and that resources are needed, that scientists don't work for free, and that these things cost money. And there is a process, and there's the new TSCA for EPA to have funding, but that's not going to happen without the support of stakeholders as well. So I know that Stan has things to say too, and I apologize for going over a little bit.